everyone, and welcome to the Science North podcast, Give Vaccines a Shot, where we'll explore the latest in vaccine news, learn all about the global health pandemic we've been facing, and have an opportunity to learn about the importance of our immune systems. We'll be doing all of this through the lens of our expert guests. This month's guest is Kate. Kate is a healthcare professional who has been using social media to support public health measures during the pandemic. She uses TikTok and Instagram to translate pandemic science into useful tips to keep people informed and help people make educated decisions to protect themselves and their loved ones. So welcome. Thank you for joining me today. Before we go on to some questions, could you tell us a little bit about your background and your expertise?
Hi. So my name's Kate, otherwise known as Hot Science Summer at Hot Science Summer on social media. I'm a hospital-based regulated healthcare professional. I have over a decade of experience in the public healthcare sector, and I have a background in science from my science degrees and continue to be involved in various research projects. I also have experience as a former adjunct professor for a major Canadian university.
Excellent. So the reason I reached out for you is I came across your TikTok account because I usually engage with public health advocates and vaccine content. And I noticed that you were doing a lot of advocacy. And so I wanted to know what motivated you to use TikTok and Instagram to do science communication and address different perspectives in vaccines and public health issues.
Yeah, this is a long story because it took me a while to get around to starting on social media, being a little bit camera shy. So prior to the pandemic even, I was rarely on Instagram. I had deleted my Facebook account even at that point. And then the pandemic hit. And to whittle away time and keep myself amused, I downloaded TikTok for entertainment, and I saw how other healthcare workers were using it to keep their spirits up through the pandemic. And I love that. I also noticed some scientists, epidemiologists, and medical professionals on TikTok providing pandemic updates. And as we learned more about the virus, and I was motivated to learn as much as I could so that I could keep myself safe, especially since I was redeployed early on in the pandemic. And I was exposed to a lot of people, and I was constantly terrified at that time that I would catch COVID after seeing all those people dying in Italy and New York.
Yeah.
And I thought, wow, these people are really doing a great service to the public. So I followed all these people, and then hope came as the vaccines were approved and started rolling out in early 2021. So I started at that point also seeing blatantly false information about the vaccines. And I was extremely shocked and dismayed. I knew that if misinformation took hold, we would have no chance of winning against this pandemic.
Right.
And as we all know, this is a group project, and no one, we're not safe until everyone is safe. And that goes, for the global community. I had considered posting information on my account, given my science, healthcare, and teaching backgrounds, but I initially hesitated because I'm fairly private, and I was really nervous about the idea of having myself splashed all over social media. Plus, I actually really don't like being photographed or filmed, and I've slowly gotten used to this now.
So it is a challenge, that's for sure.
Yeah, it's not something that I'm still, I have to say, I'm entirely comfortable with, but here we are. So anyways, long story short, I dove in because of my strong humanistic values and because I want to be able to do something to help others through this pandemic. I couldn't just stand by and watch people be manipulated by disinformation and scaremongering. And I also had a really interesting personal experience that also spurred me to do this. So while at work in my hospital in mid-2021, we had a vaccine clinic open to the public within the hospital. So people would line up along the hallway to get vaccinated. And as I was walking by my way to the cafeteria, a man in line for the vaccine stopped me and started asking me, if I'd gotten it. He said that while he was waiting in line, a religious person had phoned him and told him that there was a plan to, I can't remember his exact words, but along the lines of exterminating people with this vaccine, that the mRNA wasn't safe. There was something about Bill Gates being behind this. Have I heard about this? I was flabbergasted that there was this man in front of me who was fully ready to go get vaccinated, yet was now questioning his decision because of these ridiculous claims. And you think conspiracy theories are so far out there that the common person would not fall for them. But here I had somebody who was ready to be vaccinated until the anti-vaccine movement actively tried to recruit him. And I was so shocked that this was just happening right in front of me. So I spent maybe 15 minutes that I actually didn't even have talking to him, but he was still clearly confused about who to believe, despite even speaking to a hospital healthcare professional in the hospital,
Right,
who had just received both vaccines several months ago. And I saw with my own eyes just how dangerous misinformation could be. So with all of that combined, and my knack for knowledge translation and project planning, I knew I could use those skills combined with my research and science background and teaching background to take pandemic research and turn it into useful, actionable information that anyone can use to empower and protect themselves during this pandemic. So I set to work. I started posting videos, and one of my videos went viral, the first one that went viral. And then after that, I gained a ton of followers, and I thought, okay, well, I guess I have to keep making content now that I have all these followers. I felt an obligation. And I joined the UN's Team Halo initiative in late 2021, which is a group of scientists and healthcare professionals from around the world volunteering their time to address COVID-19 vaccine concerns and misinformation. So here I am.
Yeah. Oh, I love Team Halo. So there's quite a few people on my TikTok feed for sure that are part of Team Halo. So
yeah,
it's a great initiative.
Yeah, and it's actually been also a really fun creative outlet for me. So yeah.
That's great. It seems almost I've heard this familiar sort of origin story for pandemic and misinformation communication scientists with using TikTok. I downloaded it because I was bored, and then I saw people in my community doing good work, and so we all joined in. I mean, I wanted to do something like that similarly, but I had a bit of restriction because of working at Science North. I had to sort of moderate my personal account with what we were doing. And so then when the opportunity came up that I had the opportunity to talk about vaccine confidence within my work scope, it was a great opportunity for me as well.
Yeah, that's great. The more of us on social media, honestly, the better, because unfortunately, many people are getting their news from social media now. And I think that's where also public health communications has fallen short, because they haven't recognized the scope and reach that social media has on the general public.
Yeah, especially so like a lot of public health units don't necessarily have TikTok. Right.
Exactly.
They'll have Twitter and Instagram, but they're not necessarily meeting their audience in that other sort of in the TikTok, sort of the younger demographic that's out there. And I just recently learned that, and it's probably been around there for a while, but I guess WhatsApp is also sort of an interesting way that misinformation and disinformation is getting perpetuated as well too. And I don't even know how to combat that one.
That one's definitely a tougher one. I mean, I've even had my own parents forward me misinformation that they received through their friends on WhatsApp.
So I also wanted to speak to you because one of the things that you were talking about was how you keep yourself safe, but still are able to, I guess, what we call live our lives, and but be able to do it safely. Recently, you went on an international vacation. So can you tell us a little bit about how you decided you were ready to travel again?
Well, I think it was a combination of part burnout and part being desperate for a proper vacation after no travel for 2.5 years and just a lot of work. Combined with being in a trough of a COVID wave, it finally made me just decide, okay, let's do this. And I also saw many people travel through the pandemic, unfortunately, even during lockdowns, which I frowned upon early on. We just didn't have enough information, I felt, at that point for it to be safe for anyone. But 2 years in, travels now started to resume at higher volumes. And I was seeing people around me who were previously very cautious start to try traveling and mostly come home safe. And I thought, well, if they manage this, armed with my comprehensive knowledge about how this virus transmits and my infection control training from my hospital background, I knew I could do this in a safer way than most people who didn't have the same level of knowledge and expertise that I did. So I ended up booking a trip to the Caribbean.
Awesome. I saw some of the footage. It looked beautiful. I had a friend who was out that way, and I was living vicariously through everybody who was traveling this summer. What kind of planning was involved? Did you require some additional considerations of how you would normally plan a trip?
Yeah, absolutely. I mean, I normally do a lot of planning and research into the destinations that I go to because I like to be a knowledgeable, engaged, and culturally savvy traveler in general, and also make the most of my trip. But this time there was an added layer of complexity with the planning because I am an immunocompromised person because the medications that I take for my autoimmune condition, and I absolutely did not want to get COVID. Not to mention that it would just ruin your trip. Like nobody wants to be sick on a trip. So, so I had to make sure I was extremely careful with my planning to minimize my risk in every way possible. And I couldn't just travel in as carefree a way as I had previously with an invisible deadly virus floating around. So, which is now, obviously less deadly thanks to our vaccines, but, there are still considerable risks with infection with, long COVID and the long-term complications that more and more research is discovering post-infection. So I use planning skills to design as safe a trip as possible, taking into account like levels of COVID risk, community levels, risk of particular activities, etc.
So what are some practical advice that you would give for people if they want to do traveling? So we're recording this, it's September now. This we're going to hopefully air this podcast a little bit later, but people travel in the fall, they travel over the holiday period. What are some practical tips that you have for people who would like to travel if they decide to travel over the holiday period?
Yeah, traveling. I actually did an entire TikTok video on this as part of my Navigating Risk series because I thought, well, I could definitely give these tips to some other people who are planning travel. So my recommendations, as an extremely cautious immunocompromised person, so people listening to this can sort of pick and choose what they deem to be important to them when traveling. If these are concerns, then there's some ideas for how to mitigate those risks. So the first one was timing. I chose to travel when cases are down locally as well as at the travel destination. So less COVID around means a lower chance of being infected in general. So it's better to try to choose to travel within a trough as opposed to during the peak of a wave. The other thing I considered was my destination. Whether there was public health protection still in place. So testing, vaccination required for entry, masking if that's important to you. And also COVID transmits less easily in warm, humid environments. So a tropical destination is always a good bet. And so I chose, a tropical destination based on that as well. It's another way to just mitigate COVID spread. Geographical mitigation as well. So, if you're really worried or a high risk person, traveling to a high density city, for example, means that you're more likely to come into contact with more people. So I chose an island that didn't have a super high population density, chose to stay slightly outside the city center. So those are all considerations if people are concerned. And things like booking flights. Some airlines still require masking. So I specifically chose to fly on a Canadian airline because of that, as masking on airlines has been shown to lower your risk of contracting COVID. And then past the flight, like once you're off the flight, you need to get to your destination. So the other consideration was also with airport transfers. Based on the research, coach buses seem to have a high risk of transmission because they're enclosed, people are in them for hours and their windows don't open. Right. So you want to choose a mode of transportation that has good ventilation to help us clear out any aerosols and droplets that are in the air. And you want to try to minimize your time spent in crowded transportation as well. So I also have a video in the same series on modes of transportation that compare the different modes of public transportation. Things like public buses would be safer And in terms of like activities too, that's also a consideration, because if you're doing, say, a coach or a bus tour for the whole day, you're going to be in that same enclosed space with a number of people. And so your risks of contracting COVID would increase.
Yeah.
Then once you get to your destination, where to stay. So planning your accommodations according to your risk tolerance. So for me, the really huge hotels with hundreds and hundreds of rooms, I knew would be much busier, and it would increase my contact with people, things like elevators, hallways. And so I picked a resort that was smaller, less populated, and with specifically an outdoor eating area.
Oh, that's good.
There are a few resorts with this, and especially in a warm tropical area. Most restaurants and resorts will have outdoor eating areas, because the weather's more amenable to doing that. So I never ate my meals indoors. I always ate outdoors because I had that option. So, but you have to be at the buffet. What was really nice was at this resort, they actually enforced masking at the buffet. So yeah, and then once you're outdoors, yeah, it was great. I felt very safe, actually.
And then maybe picking accommodation like that has like a motel style entrance or something like that as well too, right? So,
absolutely.
Or like separate cabins or.
Yeah. Yeah. So if you have an entrance directly to the outside, that's also better than being in a hallway or stuffed into an elevator with a bunch of people. I actually got a room at this resort that had an opening direct, like a patio opening direct to the outdoors. But unfortunately, I found out when I got there, it didn't lock from outside.
Oh no.
So I still ended up having to go through the hallways. But generally speaking, because the resort was quiet and the hallways were wide and open and short, like there wasn't and I was on the ground floor. It was just a really, really quick exit to the outside. So not a big deal. And the other thing too was when I was planning tours and group excursions, again, I mentioned the risk with the coach bus tours. So I tried to choose activities where there was smaller groups of people. So, tours can be varying sizes. And I opted for tours that had smaller numbers of people, shorter group tours that were open air. So we did boat tours to islands, and all the activities on the islands obviously were in open air. There was no shared food on these tours. So, you don't want multiple people's hands, say, going into like a common dish. So that is also a good way to do tours and excursions in a lower risk manner. The other thing was I masked when I was indoors, if we didn't need to go indoors for any part of the tour, like when we were first coming in to register. Other things, packing your PPE, of course. So, make sure you always have well-fitting KN95 or higher masks for the flight and the trip. Your greatest risk is when you're in an enclosed space with people with poor ventilation. I always had hand sanitizer clipped onto my bag that was readily available, because you can still get surface transmission of not just COVID, but colds and flus, right? And again, nobody wants to be sick on their trip. It's just going to ruin your trip. So the other thing I brought with me was a CO2 monitor, because it helped me gauge how good the ventilation was in a space and let me know when it was okay for me to take my mask off, like in the airport, where it was safe to take my mask off if I need to take a drink or eat something. So that was really helpful as well, because as we know, we can't see where COVID is. So your CO2 measurements can be a proxy for how good the ventilation is in a space, and ventilation can help move out aerosols and droplets. Yeah, I have so many tips. So almost done.
Yep. All good.
On the flight too, the other thing I want to mention, I didn't mention this earlier, is to keep your mask on at all times if possible. And the air nozzle above you on the flight, those air nozzles are right above each seat. That's actually HEPA filtered air.
Okay.
So you want to turn that on right away into max, so that you're getting fresh air blown onto you as opposed to breathing in your neighbor's air. Your CO2 readings may still be high inside the plane because HEPA filters don't take out CO2, but they do remove viruses and bacteria and particles. So that's the purpose of the HEPA filtration. So it does make it a little bit safer to be on a plane. Obviously, if you're sitting near somebody who is sick and coughing, whether it be in a plane, bus, wherever you are, try to move away because these are all risk mitigation measures, but the reality of it is that even if you're, say, outdoors, where it's generally lower risk, if you're sitting right next to somebody who is sick or infectious and you're not aware that they're infectious and you're talking in close quarters to them, breathing in their air, then you're still going to be at risk of catching COVID.
Yeah.
Even in a generally what would be considered a lower risk activity. And so I always tell people, like, keep in mind, COVID spreads like smoke. If you're face-to-face talking with somebody who is exhaling cigarette smoke, imagine how much secondhand smoke you would breathe in. And it's the same with COVID virus, or the SARS-CoV-2 virus. So, watch out for that, and in enclosed spaces as well with poor ventilation.
I'm always listening to CBC in the morning with Dr. Peterlin, and he's always like, try to make sure that you're not facing people when you're talking, and
which is hard, right? Because we're conditioned to turn towards people and engage with them, directly. It's also that body language also tells people that we're more open to the conversation. So it's very challenging. I mean, many of us have had to change the way we behave and modify how we do activities because of this pandemic.
Well, and I mean, I love the fact that your tip is like, and your comment about the fact that, we don't want to be sick, because I have traveled to the Caribbean and my flu symptoms kicked in a day after I got there. And so the whole week that I spent there, I was feverish with a really bad flu. No. And I mean, this was years before the pandemic, right? So, I mean, but we never thought about all the things that we could do to mitigate getting sick. I mean, I obviously got sick in Canada before I went to visit my cousins, but it was, and you're right. It's not a great way to spend your holiday. And so if you can do things to prevent yourself from getting any type of illness, then that would be the best thing to do.
Yeah, absolutely. I've experienced being really sick on trips before, pre-COVID as well. And it just ruins your whole trip. And you spent all the money and time to go there. And now you can't do anything because you're bedridden for a few days. So it's definitely not fun.
Are there things that you learned on your trip? Are there things that you would change that with regards to planning, or things that you would change with regards to how you behaved on your trip?
To be honest, I don't think there was anything I would have changed about my trip. I planned it out so carefully that I was, I think, able to enjoy every minute of it. I was a little bit disorganized coming back just because I had vacation brain. So I didn't, plan my ArriveCan. I didn't fill out the ArriveCan app and everything until I was in the customs line. So I was kind of scrambling to do that. But we can't always be on top of everything all the time, right? I think things that I learned that I witnessed how other countries who value their tourism sector and recognize the importance of public health measures to lower transmission. So, the place that I traveled, I saw how even though Canada and other countries have dispelled with most public health measures, these Caribbean countries, many of them have kept their mask mandates for indoor spaces and public transport. And they, in some cases even had still vaccination requirements for indoor dining and clubs and bars, which I was surprised to see. So it was, anytime you travel, I think it's always a learning process to see how other countries and their culture manage pretty much any situation, including a pandemic. It's always a learning process, right? So we are always within our own space here in this country and think this is sort of generally how the world is going about things, but it's not true. There are many countries that have actually kept their public health measures. And my CO2 monitors taught me a lot, like how high the CO2 can go in a plane and in busy waiting areas, but that also being outdoors in sometimes even crowded environments can be relatively safe when it comes to the ventilation. You still have very good ventilation even if you're in a crowded outdoor environment. So that was interesting for me to see, thanks to my monitors.
It's nice to have that extra bit of information to make those decisions.
Yeah.
So some of us are still cautious about our health and trying to hopefully remain uninfected. Do you think that it's possible for us to travel and get back to activities that we did before the pandemic?
Well, we were just talking about this earlier, and how it's not really normal per se. Not, everything isn't entirely back to normal. It's sort of a new normal, and I think there's always going to be some element of risk, but that risk has been greatly tempered by the vaccines and the fact that we know how COVID spreads and how to layer protections to minimize the number of infections. I do wish that there were more public health measures that had been kept, because reducing transmission overall obviously decreases the pressure on our healthcare systems, but it also allows everyone to do activities more safely in general. And I would really like to see things like ventilation requirements for indoor spaces come into play as in other countries. So, for example, in Hong Kong, they've required that all restaurants have at least 6 air exchanges per hour in indoor dining, just to make it safer for everybody, so people can do everything with less risk. I think that element of risk is always those unknowns, that what will happen after we get infected, right? The risk of long COVID and the long-term consequences, which can be considerable. Those risks will always be there, and how seriously people choose to take them will vary from person to person. And for some of us, these risks of early onset dementia, cardiac complications, lung damage, like neurological and psychiatric disorders, and diabetes, for which there's growing evidence post-COVID infection, may mean that we will have to adopt some changes to how we do things for the foreseeable future. So, for example, I know, being a slightly higher risk person, I will always mask and hand wash during waves and flu seasons, and hand wash in general. It's always a good thing to do.
Yep.
I was always getting sick, and it's been wonderful for me not getting sick for most of the past 2.5 years. But I think for others, they may view these risks on par with other risks that we take on a daily basis that can also harm us. So, driving, for example, the risk of getting into an accident, riding a bike, eating hamburgers and hot dogs, which leads to other chronic diseases. So I think everyone's risk tolerance is different, and people, people unfortunately do have to decide for themselves how much they want to protect themselves against this additional risk of COVID infections now. But we also have to remember that some people will always they'll have to change how they do things forever, really, because there are some people who have been traumatized significantly by this pandemic, like families who have lost loved ones, healthcare workers especially. I think all of us are just staying, continuing to be cautious. Some of us may never be the same as pre-COVID. So for some of us, things will probably never go back to pre-2020. Right. They'll just be exactly the same way, I should say. How we do things and how we approach our risks will have changed.
So I really appreciate you're great at articulating, you're great at communicating the science that needs to be done, and helping us make decisions with the information. What is the most challenging part, do you find, of your advocacy work?
It's the amount of time it takes, I think, to read through the research, all the research, because there's literally just studies coming out on a daily basis, and making sure the information that I'm presenting is accurate. I try to be, I feel very responsible for the information that I put out there. And I try to be careful with language and wording, because as we have seen through this pandemic, people take headlines or snippets and they run with them. And so I'm doing this in my free time, entirely volunteer. So as you can imagine, it takes up a lot of time and energy, especially since there's so much information constantly coming out. And sometimes it's contradictory to other studies. So then you have to do a whole literature review to sort of really get a sense of what the overall scientific consensus should be before you present that information. So I'm working on a post right now about myocarditis, and there's been a lot of studies that have come out this year. So I'm trying to compile that information. It's just taking me a little while, because there's so much to read through. And this is a major concern for a lot of people. So obviously we want to get the information, or I want to get the information right. And I think the other, obvious challenge for many of us is that the anti-science, anti-vaccine harassment and threats that we all receive as healthcare and scientific creators. I posted, for example, I posted a video celebrating the approval of the COVID vaccine for under fives here in Canada back in July, because I have many parents who follow me being actually asking for months when this would be available. So, followers like this were thrilled to hear, but that video has since fallen into the disinformation side. And it's amazing how angry people can get seeing a video that is simply just announcing vaccine availability and dosing. I didn't even say anything about whether people should get it or not, just announced that Health Canada had approved it and, provide that information for public awareness. So it's that part of it is sometimes it's tiring and it's challenging. I think that wears us down. We all really feel that the social media platforms could do a better job of moderating their content. As I think many experts have mentioned, we're not just in a pandemic, we're in a infodemic.
Yes, for sure. So on a more positive note, what is your favorite part of your advocacy work?
It's been pleasantly surprising how much I've enjoyed this and what's come out of it. And all the opportunities that have come out of it too, the people I've connected with, I think more than anything. So, all the curious, considerate minds out there that I've met through social media, both followers and other scientific and medical creators. It's been really uplifting and has helped carry me through this pandemic to see how many people wanted to do all they could to help us collectively get through this pandemic. I'm always happy to hear when my information is helpful for someone. I get lovely messages sometimes. So that's been really, really fulfilling for me. I think with all the other scientific and medical creators online, we've formed a brilliant community of minds to bounce ideas off each other and seek support. And it's amazing to have that reach, to just be able to reach out and get feedback from a virologist, for example. Whereas previously, I never would have had these connections and access to people who are so knowledgeable about different topics. So now, these are some of the brightest, most inspiring and altruistic people that I've met. So that's been really wonderful part of advocating on social media for public health. And in addition to that, this has also opened doors to potentially creating a greater impact for the common good. So there's been a council that has been formed to assist major social media companies in improving their content moderation policies and practices. And I'm happy to see that they are willing to work with public health experts in the field to see how they can improve with their content moderation and reduce the amount of disinformation and misinformation that has been spreading so rampantly throughout this pandemic. I really think that has worsened the impact of this pandemic overall. So I think improving social media content moderation and accuracy of information on platforms will be key to improving public health and society, I think, as a whole. This is something that I think public health agencies cannot ignore.
That's so encouraging. It's good to know. I mean, we always hear the negative voices very loudly, but it's good to know that, that people are listening to us and that there is possible change on the way.
Yes. Yeah. Fingers crossed. We're trying.
Thank you so much for taking the time to speak with me. Like I said, your knowledge, your ability to pass this on to everybody is so appreciated, and I love watching your content. Thank you.
Thank you so much. Thanks for the opportunity to speak to you today, Larissa.
Thank you so much for listening. See you next month, where we'll explore another part of viruses, vaccines, and the immune system. We also want to know what questions you have. If you have any questions based on this episode or about vaccines, viruses, or the immune system in general, please reach out to us using our email, vaccines@sciencenorth.ca. We're always happy to address those questions. If you want to find out more, visit our website, sciencenorth.ca/give-vaccines-a-shot. Also, follow us on Facebook, Instagram, and Twitter. And if you're listening or watching us on YouTube, please be sure to follow. Lastly, Give Vaccines a Shot is funded through financial contribution from the Public Health Agency of Canada. The views expressed herein do not necessarily reflect the views of the Public Health Agency of Canada.